Cash transfers have become one of the new tools of social protection in the developing world, and this short topic video takes a look for a few minutes at the debate over the effectiveness of cash transfer programs in low and middle income countries. Here's the World Bank's new poverty ratio line. This is the percentage of the population living on below $2.15 a day, PPP adjusted. And you can see that Malawi and Mozambique, nearly 2/3 of the population live in extreme poverty. In Rwanda, it's half the population. Even in Nigeria, it's 31%. Globally, about 650 million people were in extreme poverty in 2020. But of course, the effect of the pandemic is yet to show through in the data. And most economists believe that the pandemic has, by and large, reversed a decade or more of progress in reducing extreme poverty. About a quarter of the world's population live on less than $3.65 a day, PPP adjusted, and just under half, 47%, live below $6.85. Indeed, global median income is only $7.60 PPP per person per day. So keep an eye on that, because cash transfers are essentially a form of social protection, targeting low-income people, low-income households in low-income countries. So the aim is to provide, if you like, some direct financial assistance to the most vulnerable, constrained households. Typically, it involves providing a set amount of money per month, either in a local currency or in dollars, to eligible households. Now, there are two main types of cash transfer. Development economists and policymakers frequently compare the benefits and the costs of conditional versus unconditional cash transfers. Conditional cash transfers, or CCT, require that the recipients, the beneficiaries, if you like, meet certain criteria. It could be that their children attend school, or it could be that there are pre-birth health checkups, or having their children immunised. So there might be some strings attached to the cash handout. Whereas unconditional cash transfers, UCT, are provided without any such requirements. They're provided universally. And that's linked with the debate you may have come across about introducing some form of universal basic income. One of the biggest cash transfer programs in the world is in Brazil. The Bolsa Familia program has provided financial assistance for well over 13 million families in poverty. Now, this is conditional. Families must ensure their children attend school and receive regular health checkups to receive the cash transfers. And some studies have shown actually it's had quite a big effect on extreme poverty. A study in 2016 found that Bolsa Familia had reduced extreme poverty rates by 25%, and critically, child mortality rates amongst those receiving the incomes were about 20% lower than amongst non-beneficiary families not receiving the conditional cash transfer. Another good example is Kenya. Kenya is a country where there's lots of experiments on unconditional cash transfers, universal basic income. A good example is the Hunger Safety Net program, HSNP, which is now over 10 years old. The program is unconditional, and a study found that the program reduced absolute poverty by about 7.5% and critically increased school attendance rates by over 10%. Okay, so what are the main arguments supporting a strategy of cash transfers? Keep in mind here, the debate is about which policies, which interventions are likely to be most effective, most equitable, most efficient in terms of trying to lift people out of extreme poverty. Well, that's the first argument. The argument is made that direct cash transfers, giving money direct to people, perhaps even through their mobile phone, using mobile money transfer, provide a direct and effective way of cutting poverty and reducing income inequality, because you're giving money straight to people who need it the most. The aim, of course, is to improve the basic living standards of people in low incomes and reduce income inequality, cause the Gini coefficient to go down. Linked with that, of course, if you're getting better income where you are, that might reduce the pressure to migrate, either internally within a country, or there might be the pressure to migrate out of a country, which of course can cause a brain drain. A second really key idea is the idea of empowerment or agency. So the idea here is that direct cash transfers empower people by just giving them the basic financial resources and therefore the freedom to spend the money as they see fit. And this, I think, links back to the great Amartya Sen's work on development as freedom. So providing a reliable, predictable, regular, stable source of income that allows households to plan, to make investments in their own human capital. In basic terms, it can keep kids in school for longer. And as you know, if you've studied the HDI, there's a big gap often in countries between the expected years of schooling and the mean years of schooling. And improved incomes, improved freedoms, can improve mental health outcomes as well. A third argument is a kind of demand side approach. If you give people money, cash, they're likely to spend it. They may save some of it, but they're likely to spend. So people in poor households may well have a high propensity to spend. That is going to increase demand, generate more economic activity, create new jobs. So there could be a multiplier effect from cash transfers, particularly in areas where perhaps unemployment is high or underemployment, hidden unemployment, is high as well. And there's a kind of another issue here, which is to do with the fact that giving money directly, in theory, should be more efficient, more cost effective, particularly if you compare with trying to get aid to people in the form of humanitarian assistance, food, clothing, and so on and so forth. But especially, I think, in the new technologies, the mobile money technologies, such as M-Pesa in Kenya, you can, providing families have a mobile phone and you can give them a phone, you can transfer money directly from a donor in the United Kingdom, for example, to a recipient in a rural village in Kenya. The Economist in 2019 published quite a positive report arguing that there was a significant multiplier effect. Every dollar given to households boosts local GDP by $2.60. Unconditional handouts benefit recipients and their neighbours too. And the great Tim Harford wrote an article in the Financial Times in October 2015 also making the case for saying that giving cash handouts to entrepreneurs can, according to research, can be a very cost-effective way of reducing poverty. A couple of research papers. This is one of the areas in economics. It's one of the most frequently cited, and there is so much research at the moment on this kind of intervention, so it's worth keeping an eye out. Research by Jaramillo, published in Public Finance Review 2018, looked at Brazil, looked at the Bolsa Familia, and found that by tracking municipalities for 15 years, compared with low cash coverage, areas with high Bolsa coverage, the conditional cash transfer we talked about a few minutes ago, that actually reduced AIDS incidence by between 4 to 13%, therefore reducing hospitalisation and AIDS-induced mortality. So it could be, for example, the money is spent on basic medicines or better nutrition, which gives improved health outcomes for people with HIV/AIDS. So an interesting idea there that the cash transfers can reduce the burden on the hospital system. And here's a paper by Sonia Trolla-Renfrey, published in 2021, which looked at, I think this was Peru, if memory serves, that the causal impact of poverty reduction on early childhood brain activity. So in other words, a predictable monthly unconditional cash transfer may help brain activities, cognitive development in young children to develop, in part, I think, due to improved nutrition, reduced malnutrition, and reduced stunting. Esther Duflo is an economist and the co-founder of the Abdul Latif Jameel Poverty Action Lab, which is based at MIT in the United States. And she has conducted extensive research, much of which appeared in her famous book, Poor Economics, which is pictured here, looking at the efficacy of cash transfer programs, whether or not they work in reducing poverty. She did a very, very famous study in India, a randomized controlled trial, where they provided cash transfers to households living below the poverty line, and they said that it did have short and long-term benefits, including increased spending, increased household saving, and small-scale investments, including little things like being able to afford a sewing machine or using cash transfers to improve your house. Small-scale investments which can improve your ability to earn money. And a really interesting sort of NGO, non-government organisation, which I'm following at the moment, is Give Directly, the president of whom is Rory Stewart, the former Conservative minister. Now, Give Directly came out of Harvard University, and it's a non-profit organisation that aims to alleviate extreme poverty by focusing on direct cash transfers, unconditional cash transfers, in countries such as Kenya, Malawi, Mozambique, Nigeria, Rwanda, and including the United States. They've got some child programs there as well. Now, so a lot of economists, broadly speaking, think that cash transfers can be an effective, efficient approach. But there are some criticisms. Let's look at some of the arguments against. First of all, some critics argue that the system may not be sustainable because they don't fundamentally address the root causes of poverty and inequality, including things like discrimination or primary product dependency or low productivity in farming and manufacturing, or just basically fundamental absence of access to quality education, healthcare and well-paid jobs. So some people argue that pumping money into these cash transfers in the long run may not be particularly sustainable. Another argument, which I guess you've come across if you've studied subsidies and microfinance and things, is the idea of dependency. So perhaps direct cash transfers create a culture of dependency, perhaps discouraging them from seeking employment. And there might be some evidence of this, but of course if people are then put off from finding paid work, that can perpetuate the cycle of absolute poverty. Third argument is that cash transfers in theory, because you're injecting money into a local economy, in theory could contribute to inflation by increasing demand for goods and services, including basic necessities such as food. And of course, if prices go up, the real value, the real purchasing power of those cash transfers will be cut, and that makes it less effective. And there's the ever-present danger of corruption. There may be some concerns that this system might be vulnerable to corruption, particularly with government officials or others embezzling funds to well-connected groups. That said, I think GiveDirectly are particularly hot on this. They have quite robust systems for trying to minimise the degree to which fraud and corruption affects the amount of money given directly. But it's worth, I think, thinking about some of the downsides as well. Now, much of the research on conditional and unconditional cash transfers involves what's called an RCT, a randomised control trial. Basically, it's an approach used in medicine when you're trialling vaccines or other new treatments, for example. You're trying to evaluate the effectiveness or the efficacy of a particular intervention or medical treatment. And in an RCT, you randomly assign people to either the experimental group, who might get the cash transfer, or a control group which doesn't receive the intervention. And then you can maybe look at the consequences in terms of whether these things work. So I think if you get a question on cash transfers, or if you are answering an exam question and you introduce this idea, which would be super useful to do, don't forget to mention that the effectiveness does need to be tested using randomized controlled trials. Be aware of that. So there we go. The percentage of overseas aid that's given in cash transfers does vary by country and organisation. Cash transfers in 2020 were about 9%, maybe 10% of total overseas aid. So it's still a minority of overseas aid, but cash transfers are becoming more popular. They are regarded as flexible, cost-effective, immediate, and some of the research evidence suggests that they are having quite an effect. So I think this is an area of poverty reduction policy, cash transfers, that it's definitely worth having a good look at. Well, thanks for joining in this video. I hope you found it useful. If you did, please press that like button or maybe subscribe. We're super happy when you do that, and we don't take it for granted. Stay happy, stay positive, stay curious, and hopefully see you soon.